GRTC has been faced with 5 confirmed cases of our staff testing positive for COVID-19. Of these 5, 3 of the operators who tested positive have been in the hospital, they're in recovery, they're fighting through complications, and I'm pleased that they are doing better. But this is a very serious disease, a very serious virus that we all are fighting together. The 2 other cases had moderate symptoms and they're either fully recovered or they're in recovery, and we expect them to be back and healthy soon. We all grieve together for the tragic losses suffered by other frontline transit staff across the country who have been fighting this pandemic in areas that have significantly more cases than we have experienced here, and I'm incredibly thankful that we have not suffered those same losses here in Richmond or at GRTC. All of our frontline workers and our administrative teams have been working continuously for the past 8 to 12 weeks to prioritize the health of our staff and our community as we provide essential service and mobility needs to everyone in the Richmond region. The service our riders depend on to get to health care, to get food, to fill prescriptions, attend dialysis treatments, and to go to other essential jobs that support the other essential services our region depends on. Starting in early March, we very liberally enacted paid quarantine for all staff. And that was when we had severely restricted or even no access to COVID testing. We still had those paid policies in place. And we continue to have those policies and that quarantine in place today as we have more access to testing through Henrico County, through Better Med, and other local resources. Those are being paid for and supported completely through GRTC. We are closely working with the health department to ensure that we have all recommended practices in place from the CDC, and to go further and beyond those practices. As soon as we hear about them across the country, we bring them to Richmond and enact them here. Also starting in early March, we were able to quickly enact social distancing on our service by going to zero fare through the support of our mayor and our regional partners. That allowed us to do rear door boarding, have social distancing of our passengers and our operators. We found locally sourced masks, such as this one made by a local community member, that we provided to all of our staff members. Other PPE, including gloves, hand sanitizers, a lot of those locally sourced and came from local sources as we looked nationally and sometimes internationally to find supplies that were unavailable to us as the rest of the country used those resources in their healthcare facilities. Many of the actions that you're seeing implemented today, including the enhanced cleaning on our buses, are things that we have been actively working on for the past 8 weeks to implement. Due to shortages, they've just taken sometimes hour to hour, day to day, even minute to minute action of our staff to get them in place and put them on our buses. And this includes the face shields that our operators now have that came locally. The driver shields that are coming into place now will take us several more weeks to get them in place to create that sneeze shield barrier between our drivers and our riders. Also, the hand sanitizer that we received locally. We also found that Perel, when we tried to get those hand sanitizers on every single bus, have been unavailable to us for over 8 weeks. Another vendor was able to come in, and now we have hand sanitizer at the rear door of every single bus and every single van. So as people enter and exit the bus, they can use that hand sanitizer as one more measure to stay protected. With the state and federal CARES Act relief funding, and with the regional mobility funding that we expect to see later this year, GRT has projected that our resources will be able to support all these additional sources of costs. We will be able to support the reduced revenue from the economic downturn, and we will get through FY21. And we will maintain all existing transit services in the region, and with our current frequencies, in some cases enhanced frequencies where we have high levels of passenger boarding. However, the mobility policies that we are making today and the practices and how we're spending money today will impact us in FY22, as we are looking to pay for frontline pay for essential staff, higher standard of cleaning for the PPE and supplies, ongoing zero fares, not just for safety but also for economic recovery, and the higher frequency on essential routes that still have high boarding in economically distressed areas. We will all need to come together in an open conversation about how we define and fund public mobility services and where we apply that funding in local transit for FY22. But we will serve, and we will serve well in FY21. Mayor Stoney asks me on our update calls, his comment is, what keeps you up at night? He says, what do you need our support? How can we support you better? And my answer is not about the funding. I believe that we do have that covered now with the CARES Act, the local and the regional funding that we are receiving. What keeps me up at night, every night, is fighting every day to keep our GRTC essential staff healthy and safe while ensuring that our community still has the essential transit service it needs every single day. Where GRTC needs support is to spread the message, to ask everyone to limit the trips on buses to only essential needs, to wear masks in public, and to actively support and encourage our frontline staff who are working through this but are still experiencing the fear of this virus. GRTC is doing all that we can to protect the physical and financial health of our staff, to hold their jobs and benefits secure, and to maintain our service for our community safely and effectively. However, our operations are only stable if our operators are stable and healthy, and we need the entire community working together to make sure our service stays that way. As we all face the unknowns of the coming business reopenings, it's critical that we all together take responsibility to keep our operators and all of our frontline employees safe and healthy. Without them, there would be no transit service to get to the critical jobs, no paratransit access to dialysis, no trips for food at the beginning of the month that we need to feed our families. So we ask, please continue to limit your trips as we reopen to only essential trips. When you need to ride transit, please use the rear doors. We will continue to stay zero fare. Please use the hand sanitizer on every bus when you get on and when you get off. When you're on the bus, please stay separate from other people. Stay physically separated as much as you are able to, even though we know that our buses operate with more people than we should with social distancing as we serve the needs of the community. And most importantly, please, please, please wear a mask. We have already distributed over 4,000 masks to our employees and our riders. We have another 20,000 on order that we hope to get in the next couple of weeks, so that as people are entering through the front door of the bus, where they interact with our operators when they need that wheelchair access, we have a mask to give to them. We have more that are going to be coming beyond that. This is going to be an ongoing effort by GRTC to supply those masks to our riders. Because without our operators, without the service that they provide to us, we have no service for the public. We have no transit. So thank you to our community and our local leadership for your ongoing support of GRT and our staff, but mostly thank you to all of our frontline workers as you continue to support us.